Dear colleagues of OHI-S, my name is Nicolas Aronna, and I want to thank you for the interest on my course, Immediate Implant Placement. As you know, immediate implant placement has been linked to immediate loading and immediate function, which are two different aspects of the immediate treatment with implants. And it is very important to know when we are performing a new technique to know the reason why we are using that technique. This is the reason why I want to introduce a little bit or give you an introduction of my course and explain you the basis of this trending technique that we are seeing everywhere performing today. Because it's not only the importance of performing properly the technique, but performing the technique in the appropriate place, in the appropriate moment, and especially with the appropriate reason to do it, to get the most benefit out of it. And I would like to share a summary of my course, because immediate loading, as I said before, it is linked to immediate implant placement. It is linked to so many requirements to be successful. As well, avoiding complications derived from non-proper analysis of the case. If we standardize our treatments, we are going to end up facing a lot of complications. This is the reason why case selection is very important, and it is a very important factor when we're performing these kind of techniques. The first part of my course, we are going to talk about immediate loading, when, where, and why. And you will learn the most predictable way to perform this technique, taking into account all the different aspects that this kind of technique requires to be successful. It is important to know the difference between immediate loading and immediate function. These are two different things. With the same concept, in different stages, we can have immediate loading that takes part of the early loading or the delayed loading as well. What's the real difference between both immediate loading treatments? The factors involved in immediate loading concepts to be successful in our treatments. The fast and quick osseointegration concept. It is important to know that the fastest an implant surface osseointegrates, the less potential complications we are going to have to face derived from non-mature bone around our implant. The analysis of the anatomy to guarantee primary stability of your implants. If we are going to use an immediate loading technique to our patients, we are committed to do these kind of treatments, and we are committed with our patient to provide these kind of treatment. It's mandatory to achieve primary stability. And that primary stability will depend on so many factors. The anatomy, bone resistance, the design of our implant. And this is part of the process that we need to learn before performing that technique and before offering that technique to our patients. The limitations of immediate loading, the use of spatial, obviously macro design of our implant. Prosthetics, what kind of temporization are we going to use? How am I going to customize my temporization to be aesthetically acceptable for our patient and at the same time have an anatomical sense and anatomical support for the soft tissues and the hard tissues? The ideal 3D positioning, today we're using a lot of things. Today we're using 3D technology, not only to diagnose and to find the best place to place our implant, but also to guide it if we're using guided surgery. The biomaterials are going to stand our regeneration, especially in the gap, especially at the socket placement, which there will be some biomaterials that are more prone to infection in cases of non-cooperation from the patient's stand. The non-drilling technique as well, that I am about to publish in the next months, where we do not even need to drill and create a new path to place our implant, but directly to the socket we can achieve amazing primary stability. The immediate loading at posterior and anterior sides, step by step. And all these kind of things are going to be explained in order to understand the reason why we're using that technique. And as I said before, immediate loading is bonded, it's linked to immediate implant placement, which means that I need to be very accurate when analyzing the case and planning my immediate placements, because at the same time I need to achieve primary stability, ensure that primary stability, work on the prosthetics, avoid micro movement, and keep an eye on the treatment for long-term results and stability of our implant, especially during the osseointegration process. But as I said before, we not only like to share all the benefits and all the good things, but also we like to share our complications, because from complications we learn as well. This is the reason why in my second part of the course, we're going to see complications in implant dentistry. Most of them derive from immediate loading and immediate implant placement cases that affected our results and the way that we treated it in order to save the case. In the part one, we're going to see the types of complications. If we have technical, if we have mechanical or biological complications that we're going to need to face, and the risk factors associated to it. The complications in time, it's different to find a complication that is early diagnosed than a delayed complication that actually ended up destroying much more bone and soft tissues due to the lack of control from our standpoint. We are going to repeat the importance of fast osseointegration concept and how the fast osseointegration concept can avoid a lot of complications that potentially are going to be there and we are going to have to face. The guided surgery to avoid wrong implant 3D positioning as well. Today we're using amazing 3D guided printer machines that even in the house we don't need a lab to do these guides. We can actually customize them, we can actually design them and then print them and use them in our patient's mouth in order for us to be more predictable at the time of the implant placement, and also reducing the time and cost for the patient and for us as well. But what about complications in the aesthetic zone? The aesthetic zone is a part of basically our field of work that compromises us when something does not go right. So sharing as well complications in the aesthetic zone, it's a way to learn and it's a way to improve our techniques, especially when those complications were derived from non-proper analysis of the case. If you use the literature, if we try to find scientific evidence behind the techniques that have been developed, we are going to be more predictable. So literature and scientific literature is there to take a look at it, to analyze it, study it, share it, and criticize it sometimes if it can be criticized. The socket type classification and sub-classification. Sometimes we have the typical classification, but the classifications are going to evolve over the years depending on how that technique has been evolving and how that technique has been shared by clinicians that actually publish amazing articles. So it's not only about the classification, but also sub-classification of the cases. And obviously the complications associated to immediate implant placement in the wrong place, or in the wrong moment, or in the wrong case. The soft tissue management, sometimes we need to have handling, we need to have management of the soft tissues. That's why learning techniques to manage the soft tissues will allow us to be more predictable, and will allow us as well to be much more efficient when doing these kind of techniques. Guided bone regeneration with titanium mesh after severe bone loss due to traumatic extraction. We have an amazing surgical video that you're going to be able to see. And the surgical treatment of retrograde periimplantitis. It's important to know how are we going to diagnose these kind of cases, and how are we going to treat these kind of cases as well. At the part 3, we're going to see more complications derived from implant placement techniques, such as dental implant fracture, how to diagnose it and create a predictable treatment planning that will guarantee the success after failure. Because the patient comes to us, either if it's coming from a colleague or it's coming to you after failure, the patient needs confidence, to get the confidence back. And the best way is to know how to analyze the case, to provide the patient with the best case solution. The levels of osseointegration to fully understand the removal options. And when am I going to use a trephine? When am I going to use a kit retrieval to just counter torque the implant and have an extraction implant placement that is going to be very atraumatic? I'm going to be predictable at that point. Well, there is a reason why sometimes those implants cannot be removed by just trying to counter torque them. So the biological reason why it's there, if we understand it, we're going to be more predictable at the time of the extracting that implant using specific techniques and following step by step. The management of moderate periimplantitis due to malpositioning. We have a 3-stage approach to ensure your success. And the minimally invasive soft tissue management in the aesthetic zone using VISTA. VISTA is becoming back a very important and interesting minimally invasive technique, surgical technique that will make the difference between you and your competitors. So learning this technique will ensure a lot of success in your surgeries. Apicoectomies using VISTA, and obviously immediate implant placement in the aesthetic zone after a severe trauma. You will always see an amazing video with high quality that will let you see a case like this. So after this summary of immediate loading, immediate implant placement, and complications derived from immediate loading and placement cases, I consider when I started this course, when I did this course, the best way to understand the reason why things happen. And as I say, and as I always say in my lectures, I want to know the why. And the reason why things happen is the most important aspect, because you can have many treatment plannings, but you're going to have only one diagnosis. So every time that something happens, please ask yourself why. And this is the reason why is the word why is repeated so many times in my lectures. So this is the summary of the case. This is a summary of the course, sorry. I hope that you enjoy, I hope that you learn a lot, because there is a lot of content, and I'm very happy to announce the course here in OHI-S, an amazing platform to keep learning from home and to be able to recheck the lectures as many times as you want. It's a very, very good way to keep learning, because this is a long run, this is a long story of us. We always keep learning and sharing, and I'm looking forward to see you downloading the course and enjoying the course. So looking forward to see you very soon, and bye-bye.